The opioid epidemic. It's the deadliest drug crisis in American history.
And the opioid epidemic in the Commonwealth is now considered a public health emergency.
The number one killer of Americans under the age of 50 is now drug overdoses.
In 2017, the U.S. government declared the opioid epidemic a public health emergency. Opioids are a class of highly addictive drugs. As they bind to receptors in the brain, they block dopamine inhibitory transmitters and promote the release of dopamine. Since the prefrontal cortex is not fully developed until the age of 25, these deadly drugs are especially addictive among children and adolescents. Despite their evident danger, a standard opioid prescription post-surgery generally includes 30 pills, a quantity sufficient to lead to overdose and possible death. Overprescription and opioid misuse have had drastic consequences. In the US alone, approximately 50,000 deaths resulted from opioid overdose in 2019. In 2020, an estimated 80% of 83,544 drug overdose deaths involve these highly addictive, overprescribed drugs. Data shows that the most effective solution to slow deaths from addiction is to prevent their initial development. That is why we developed SaluDose, a smart pill bottle for opioids that aims to prevent addictions before they begin.
Our product is a restricted pill bottle for opioids like Percocet and Oxycontin that automatically dispenses pills only at designated intervals. Utilizing a user-friendly program, a doctor, pharmacist, caretaker, or parent can program the correct dosage and frequency for taking the pills. Once the time is up, the base will rotate and the appropriate amount of pills will be accessible. Because doctors across the country agree that opioids shouldn't be taken for long-term pain, we've chosen to include only 8 slots. If a patient thinks that they need more, they'll have to go to a doctor or pharmacy where someone qualified can decide if that is appropriate. Additionally, in a more refined prototype, we will add a horizontal divider to accommodate to cases where more pill slots are necessary. To refine the product, we've included additional features such as a photoelectric counter and an electrically connected visual display which shows the number of doses remaining. Another element is an anti-tamper alarm that is activated if someone tries to break the device to access the pills. If the alarm is activated, doctors, family members, or other caretakers will be alerted. In order to make our product more sustainable, we plan to make the pill bottle and mechanism out of polylactic acid, a biodegradable plastic.
Although there are many smart pill bottles on the market, the industry only focuses on reminding patients to take pills for an entirely different drug class. However, our product SaluDose propels the smart pill bottle industry past its status quo by applying its technology to opioid addiction prevention, and in turn, creates a whole new industry that aims to fuse smart technology with medical and pharmaceutical packaging. While current products market directly to customers, our product aims to expand to hospitals and pharmacies. In turn, our product's customer base will grow to include medical professionals, ensuring that all patients who receive prescription painkillers from our partners also receive our restrictive pill bottle. In the future, we also hope to partner with big pharma corporations to improve ethical business practices surrounding drug production and distribution. Our product aims to eliminate irresponsible opioid prescriptions and dosage ambiguity, reduce prescription volume, long-term reliance on addictive painkillers, and opioid-taking anxiety. It also raises accessibility of smart pill bottles and opioid dose adherence, and creates a market space focusing on eliminating addiction in pharmaceutical packaging and an eco-friendly solution to the drug abuse epidemic by using polylactic acid, a biodegradable plastic. Our strategy canvas displays a more in-depth analysis to show how our product eliminates problems in the existing industry, creates value in its new industry, and differentiates itself from the current solutions. Using 3D printer filament and an Arduino board, the product costs us $19.52 to produce. However, when we find a deal with a company that can mass produce our product, we predicted the production cost could easily go down to less than $5 per unit. With this $5 price in mind, we would sell the product for $15 per unit. But as our company expands and the production costs decrease, we plan to bring the price down as well to make it as accessible and affordable as possible. People, especially young adults, shouldn't have to pay massive amounts for their personal safety, which is the reason for our low price. From here, we would like to distribute our products by landing deals with hospitals and big pharmacies like CVS, Walgreens, Target, and Rite Aid, where most people obtain their opioid prescriptions post-operation. Here, they would distribute all of their opioid prescriptions in our SaluDose bottle. This will help us scale our product, reach a larger market, and decrease production costs to maximize scalability. With this large scale and minimal competition, we hope to capitalize greatly off of the smart pill bottle industry's $3.63 billion market potential. Although our product will still be slightly more expensive than a standard pill bottle, it aims to satisfy our customers' emotional needs as well by reducing anxiety related to becoming dependent on opioids. SaluDose is the future of ethical and responsible drug consumption. Dive into our blue ocean and help end opioid addiction.